Welcome, everybody, to this week's episode of Weight Loss Winformation. We're taking a fun detour today, and we're going to talk about something that you may or may not have given a lot of thought to. Now, I know you give a lot of thought to your skin because as you lose significant amount of weight, a lot of times there's extra skin to deal with, but we are going to talk specifically about your face. And as you lose weight and as you go through stress and as you go through whatever you're going through in your journey of life, and specifically on your weight loss journey, your face and your skin are affected. So we have a double board certified dermatologist here with us, Dr. Mina. She's got over 15 years of experience. She's in Atlanta. She has her own podcast, and I've listened to several episodes, and it's really great. I've picked up some wonderful tips, and we're going to talk about a couple of those with her in just a minute. But let me introduce you. And Dr. Mina's podcast is called The SkinReal, REAL. Welcome, Dr. Mina, and I'd like for you to introduce yourself to our listeners.
Absolutely. Thanks so much for having me, Connie. It's super fun to talk to another Atlantan, right?
For sure.
Yeah. So, you kind of hit the nail on the head. I'm a dermatologist, which is a medical doctor who focuses on the skin. Much of my practice has been focused on procedural dermatology with a heavy emphasis on skin cancer and what's called Mohs surgery. Some of your listeners may be familiar with that, or maybe even had it, just because the sheer number of skin cancers is on the rise. And a couple years ago, I say a couple years ago now, in COVID, right? Like the world turned upside down, and I really just had a existential midlife crisis, if you will. And I realized I love what I'm doing, but if I can't physically be in my clinic seeing patients, how can I be there for them, and what value can I bring beyond my clinic walls, especially in a pandemic, right, where everything is shut down? And I really started getting into podcasts myself, and I thought, you know what, I'm going to create a podcast because I wasn't happy with the information that I was hearing out there on Instagram and TikTok and YouTube and podcast even. I just felt like there was a lack of dermatologists, right, the true skin experts out there giving really solid information and education. And so I started the podcast about 3 years ago, and it's just been a ton of fun. I really, really enjoy it. And I love getting to come on other podcasts.
Well, your episodes are so great because they're so real and they're so applicable to every day. And, people want to have great skin, and yet that's where people go, Instagram and TikTok. And so I love the fact that your episodes are out there giving really great validated information. And I got to say, what my favorite episodes were? The
What's that?
psychoderm ones.
Oh,
You
wow.
had
Great.
Yeah, obviously, I'm all into the mind-body connection and how that affects our health, and that was really, really fascinating to hear you present information about how stress can affect our skin. So I'm thinking
Oh,
as people go through the weight loss process, they're under tremendous amounts of stress, and their physiology changes in terms of what it's doing while it's losing that weight. So it's so great to have you on here because this isn't something that, you know, I normally would have thought about. People are very focused on their skin because there's a lot of skin removal surgery and things like that. But we need to talk about facial skin and how those hormonal changes and things affect people while they're going through that weight loss process.
Oh, absolutely. And I think one of the criticisms Western medicine has gotten over the years is that, we only focus on diseases and curing or fixing diseases, which back for 100 plus years, that was the case, right? But we didn't have the chronic illnesses that we have today, right? It was more
Sure.
imperative to stop the infection and prevent sepsis, right? Like we weren't trying to manage diabetes and heart failure and COPD, right? And so the times have changed now. We have gotten, just amazing discoveries in medicine and science. We are living longer and longer than ever before, but we're now facing new problems, right? Like we're now facing these chronic illnesses that a
That's
lot of
right.
times are lifestyle related. Even skin cancer, right? A lot largely preventable, right, with sun
Sure.
protection early on, things like that. And so we really need, as physicians and doctors, to reframe how we're thinking about taking care of our patients. Because while yes, if someone comes in with appendicitis, your goal is to cure them of their appendicitis before they have their intestines rupture or whatever. But we also need to focus on more of a holistic way to see illness, because so much of what we're seeing and treating nowadays is really whole body connection and weight loss for sure. I mean, this is a huge problem in our country, like obesity and all the medical issues that come from it, and psychologically too, right? For
Yeah,
people trying to
for
lose weight,
sure.
trying to do all the right things, and struggling and having such a hard time. And certainly the face seems to be like one of the first places you notice that weight loss. I feel like a lot of people, I've
True.
seen it in myself, right?
True.
Yeah.
So you focus on a lot of lifestyle kinds of medicine in your practice. Like you talk about sleep, you talk about nutrition, you talk about stress and how those things impact skin. And so how do you guide your patients to address these factors alongside, normal skincare, which we'll talk about too, because that's always fun. I love skincare stuff.
Yeah, well, it's certainly tricky. Oh, can you? Oh, there you go. It certainly can be tricky in the insurance based model that we have, right? Where the visits are very short. It takes months to get in, and also again, this is why I think it's important for doctors to give sort of this educational information away for free, because we just don't have time in our visits
That's right.
to cover everything, right? But I would like people. I think too often we think of our skin as just our face, which I know we're talking about the face today, but your skin covers your whole body. You have skin all over. And it's more than, I say, it's more than just a pretty face. Of course, that's an important component, the aesthetic part. That is the first thing people see. It's, outwardly how people respond to us. And it can contribute to how we feel about ourselves. But
For
our
sure.
skin is an actual organ, just like your heart, your lungs, your brain, right? Your nervous system. And I don't think we give it the due respect that it deserves as a true organ. And just like every other part of our body, everything works together. I mean, the human body is phenomenal. People talk about, detoxing, cleansing, and all this stuff. It's like our body was made to do all these things. We
Mhm.
just keep getting in the way of it, right? With
That's such a good
not
point.
eating healthy and doing all these things. Like our body knows how to do all this stuff, but we're getting in the way of it. But our skin, what I think is so cool about the skin is that it really is a reflection of what's going on internally. And I have
Ooh,
diagnosed some really amazing things, like just cool, based on cool skin findings that I see, where I'm like, okay, these nail findings mean this person has some lung issues, or these little skin papules
wow.
could be associated with some abnormalities in the blood vessels of their heart and eyes. And I'm able to pick up on that when they're 20, instead of waiting for them to have a heart attack at 50 and figure out they've got this genetic
Wow.
condition. So
That
that
is amazing.
it's really, I mean, that the skin is so awesome. I say that it's not just reactive, it's reflective. It reflects the health on the inside. So we
Gosh.
need to take care of our bodies from the inside. And if you don't do that, you are going to be wasting a lot of time and a lot of money coming to see me, coming to buy the newest, product, potion, and procedure, and you're
Right.
not going to get the results you're after, because you've got to lay that foundation first and foremost, right? It's like building a house. You don't start by decorating, right? You lay a foundation, you put up the walls, you put up the roof, and then you can go in and put up the wallpaper and the rugs and
You
all
can
that.
decorate. Yeah. I
Exactly.
love hearing you say this because this is a large part. Well, you said so many things that I want to touch on. First, my favorite trivia question: what's the largest organ in the body? And it is the skin.
Right.
And people don't often think about that. But also, you said, it's important that we give away this free information. And, it does take our time and our passion and our compassion and our this is what we do when we want people to be healthy, and the message that you're giving is so in tune with what I do and so many other people, it has to start on the inside. And this is so much about lifestyle. So
Right.
when you find those findings, like, did you study those in school? Like, you can tell something on the skin's related to the lungs
Oh,
or is
yeah,
that something you learned?
that's all part of dermatology residency, right? So
Wow.
after medical school, where you learn, the basics of the organ systems and biochemistry and pharmacology and all that, then you go out and you're a resident in the field that you've
Mhm.
selected, and that's where you
Right.
learn about all these skin conditions. There are over 3,000 skin conditions,
My
and
gosh.
so a lot of them are sort of not super common and more rare for sure. What I was describing, these are not necessarily common things,
Right.
but they're out there, and I
Mhm.
really feel like I really helped that woman in her 20s with this condition, because now she knew, potentially saved her life. She knew to go
For
see a
sure.
cardiologist and an eye doctor, and she
Gosh.
wouldn't have known that otherwise. We would have had to wait until something bad happened to then hunt for what was going on.
Yeah, and another plug for dermatology because my thought, what I've always heard is go to the dermatologist once a year, get your body checked. And I don't know that a lot of people do that. And I think
Yeah,
it's really critical. I mean, beyond skin cancer, clearly.
right.
But let's talk about how sleep, for example, affects the skin. Because one of the things with obesity is a lack of good quality sleep, less than 5 hours for sure, is going to impact a person's weight. How
Right.
does it affect their skin, sleep?
Yeah, so it affects your skin just like I would say sleep is most important for kind of the reset for your skin. This is when your skin can reset. It can, our skin cycles every 21 days, about every 3 weeks. And so this is the time for the skin to cycle. This is when blood flow can really be maximized to the skin. This is when hydration happens and healing, when abnormal cells are removed from the body and cleared out. This is like the body's reset, just like it's our brain's reset and our heart and our lungs. And so if we're not sleeping, we are going to be stressed. We aren't going to be eating well. We're going to see it with the skin, dehydrated skin under our eyes, or puffiness. So it's all interconnected, right? You aren't going
Yes.
to eat well, and that's all the sugar that's going to affect your skin as well. So your skin needs time to heal and recover, just like any other part of our body, right?
When somebody comes into your office and you've been practicing for long enough and, can you take a look at them and have some initial like, "Oh, too much sugar. Oh, not enough sleep. Oh, unhealthy diet overall."
Well, to a degree, right? I can come in and see if there's sort of like dullness to the skin that um, I would say really obvious ones are smoking, right? Number one,
Sure.
smoking and sun damage. Like those are pretty obvious. You can tell right away. But you can also tell if there's chronic stress. They probably have some bags under their eyes, maybe some blood vessels on the skin that worsening of rosacea, things like that. So there are some telltale signs for like pre-diabetics, with that
Hmm.
thickening of the skin in certain areas, things like that. But a lot of times it's more like I can't necessarily look at them and say they're eating a lot of sugar, right? It's more that their skin just doesn't have that vibrancy, that elasticity that it should have. And it's really interesting as a dermatologist to sometimes I have to really do a double take on people's birthdays, because there's such a wide range, right? 60-year-old for one person might look like this, and for someone else it looks like another. And that's
Mhm.
really been interesting for me to see how there's such a range, right? Depending on, not just your genetics, right? But it's really your lifestyle, how you've
Absolutely.
lived your life, right? And have
Yeah.
you taken care of your body?
Yeah. I grew up in the era like 20 years before you where we didn't put any sunscreen on our skin. We baked it with the baby oil and all the
Yeah.
horrible things, and everybody smoked at
Yeah.
that time. And so, fortunately, I had a very short stint with smoking in college because that's what you do. You grow up, you go
Right.
off to school, and you smoke. Well, I didn't like it, and my siblings now, I have a couple who have smoked all these years, and the difference in our skin is unbelievable. It really
Right.
is, and it's like, wow.
Yeah. They've done some side by side twin studies where
Ooh,
one twin smoked and never wore sunscreen and really didn't take care of themselves, and then the other one did, and it is remarkable. And sometimes people say, like, what's the secret to beautiful skin? And they're thinking I'm going to say, oh, it's this vitamin C product. If you buy this,
right,
you'll have amazing skin. But really, other than lifestyle and taking care of your body inside and out, it's and not smoking, right? It's sun protection. Like if you just do that, and again, no one is perfect, right? But if you just make it a goal to every day try to be 1% better than you were yesterday, in
right.
20 years, in 40 years, can you imagine the benefit of that? It's
Oh,
huge.
absolutely. My granddaughter, my youngest one is 8, and about 3 or 4 years ago, she would be very defensive of her Gigi, me, and she'd say, "Gigi has wrinkles not because she's old, but because she didn't use sunscreen." I'm like, "Thank you, honey." So
Well,
tell
yeah,
me.
those kids are good at pointing out your flaws. Like, "Mom,
Oh my god.
why is your skin so crinkly?" I'm like, "Well."
Oh my gosh. When they were young, my one of my other grandkids came up to me and said, "Why is your face cracked?" Cracked. I'm like, and then
Oh.
they would draw pictures and they're like, "Look, we even drew your cracks." I'm like, "Well, that's so special."
Oh, yes, yes, the honesty.
Which brings me to a question about this rejuvenation of the skin in every 21 days. That's the skin cells rejuvenating. Is that what you're saying?
Yes, yep, uh-huh.
Well, then why do they not just rejuvenate all plump and fluffy and full of collagen like they used to?
I know. Well, a lot of things, and trust me, researchers are looking into that, right? Why do we start losing our collagen at 18, right? Like at 18 or early 20s, you're at your peak collagen, and then it slowly declines until menopause, and then it just like drops off significantly. So, yeah, why is that? Now, we certainly know things can accelerate that. Again, pollution. I hate to use the word toxin because it's so, you know, uh,
Strong.
general, it's like, well, what exactly is a toxin? But things like UV damage, right?
Mm,
Nicotine, pollution in the air, like these are all things that can damage our skin. It's sort of impossible to fully get away from all of these, right?
right.
But it's important to think about them and try to
Mhm.
improve on that. But estrogen for women, losing estrogen is huge. I mean, it's why our skin starts becoming very dry. We lose hydration. We can't hold on to moisture like we could. We lose collagen. And so estrogen's a huge component. But yeah, people are certainly looking into this, right? Like how do we keep that youthful skin for as long as possible?
And you also talk a lot about pro-aging, and I really do like that. And I wanna talk about that in a minute, but I was thinking about as people lose weight, there's a lot of hormone changes happening in their body. And do you see that affecting the skin, and in what ways do you think?
I think the biggest thing affecting the skin with weight loss is when it's dramatic, when it's
Yeah,
sudden. That skin,
yes,
and they call it Ozempic face, right? But it could be any rapid weight loss. The skin cannot accommodate that sudden shift, and so you have a lot of what we call laxity, that loose skin, that crepiness. Especially if you are older and this happens, it can't bounce back as well because it's already through natural aging process has lost some
correct.
elasticity and collagen, right? Um, so it's kind of like, when you have a baby, right? I mean, it's pretty remarkable how much that skin can stretch. But if you lose that weight very quickly or you gain weight very quickly, the skin can't respond fast enough. So you get the stretch marks and the
Right.
crepiness and things like that. So that's really the biggest thing I've seen my patients who, especially with the GLP-1 agonist, they do a beautiful job with weight loss, but it's so rapid that you get that sagging skin. And then also if you are losing muscle at the same time.
Right.
So that kind of compounds why we notice these changes in our face. We're not only just losing the subcutaneous tissue, the fat. You're also,
Mhm.
as we're aging, we're losing bone. We're having bone resorption. Our
Yeah.
jawline is moving backwards. Our eye socket is widening and opening. We're losing muscle, and muscle is sort of the structure under the skin that gives it support. So these are all kind of working against us, I guess you could say, as we age.
Exactly.
So these are natural processes, but what are ways we can maximize our skin health, our bone health, all of these things to kind of minimize that. But I would say, again, with weight loss, try, and I think I'm not a weight loss expert, right? But I do remember people saying like starvation diets, strict calorie restriction, all of that. That's not a sustainable way to lose weight.
Correct.
You may drop it very quickly, but it's not going to stay, and that's also not ideal for your skin.
I can imagine that rapid fluctuation up and down, and a lot of the people that I work with, that's what their life has been, a
Yeah.
lot of yo-yo dieting, and so then they either go on the GLP-1s and they have this weight loss surgery, which is great for improving their overall health and giving them an opportunity to do things they were not able to do, but it really does affect their skin. So,
Right.
what would you recommend to somebody? Because you talk a lot about how emotional well-being and our skin, you said, it's the first thing people see is our face. And so now these people who've lost a lot of weight, a lot of times they don't even recognize themselves in the mirror. And maybe their skin has changed in not such a good way. So if they come and see you and they say, what can I do? What kind of suggestions would you give them in terms of how to approach their skincare?
Yeah. Well, first of all, I would say congratulations. You were able to lose weight. That's a huge feat. That's a wonderful thing you've done for your body to keep
Exactly.
yourself healthy in the long run, right? So I think rather than celebrating that, a lot of times you're focused on, oh, but now look at this and all.
Yes.
And I see
Yes.
this at least once a week with patients who
For
who
sure.
have experienced that. So I really would just start with the basics. Talk about what their skincare is. What are they using for their skincare? It does not have to be complicated. In fact, usually I'm paring down their skincare. I'm saying, okay, you don't need that. These things do the same thing. You don't need this. Add this. So just making sure they're on a very simple but effective skincare regimen based on what their skin needs and sort of what their goals are. First and foremost, that's the most important. And then I would just talk to them about things they want to potentially change and what could be realistic expectations. Um,
Right.
a lot of these tightening devices and things that we have, I mean, they can help to an extent, but for a lot of these patients, it really is surgery. And I know that scares a lot of people. But when you've got, a lot of excess skin, it's
Sure.
I just feel like you're going to waste a lot of time and money on these devices that really aren't going to give you the impact that surgery would do. So surgery may be an option. If surgery is not an option for them or they're not interested, then we do have devices that can help. One of my favorite things to do just to make anyone feel better about themselves is to even out their complexion. And I'm
Yeah.
not necessarily targeting loose skin, fine lines, wrinkles, all that. I'm just making the canvas of your face more even. And whenever I do that, everyone looks better no matter what. So a
Are
lot of
you talking like skin spots, like age spots, that sort of, or are
well,
you talking about texture?
both. So it kind of depends on what people have, but a lot of times, especially as we're older, I would say, 40, 50, 60, that's when we start to notice the texture of our skin is maybe not as even. Maybe we do have some discoloration. Maybe we do have some enlarged pores and things like that. But just by doing a resurfacing procedure, whether that's with a laser or chemical
Okay.
peels or topicals, this can be a lovely way to just brighten the skin, and it
True.
makes everyone look better and it just makes people feel better, right? They just look in the mirror and their skin has a glow to it. I'm not
I
necessarily
agree.
fixing the loose skin, but it just makes everyone look better. So sometimes that's all it takes to help. But
And
it really is
yeah.
individualized based on what their concerns are,
Yes.
how far they want to go. Some people don't want injectables. Some people don't want surgery. Everyone's got their different comfort level.
Yeah, and I think it's really important with our patient population, all physicians and all mental health and anybody who's trying to help other people is at some point there's got to be a level of acceptance
Right.
and recognition that let's work on what we can influence and let's work on accepting the things that we can't. And let's, like you said, congratulate what you are doing. Let's look at what you are doing and not focus so much on what you're picking about that other people aren't even concerned about because we're so hard on ourselves. I also really appreciate that you talked about, you can spend a lot of money on, it's almost like the weight loss. People come to a point where they're like, all right, I need to either do these GLPs or have a surgery or something because constantly looking for that magic thing that's going to fix my face or fix my hair or fix my body or fix my weight. It doesn't really exist.
Right.
And it's all about lifestyle and connecting that lifestyle to be maximum for your skin, for your health, for your hair, for your everything. And then doing some of the damage control that you're doing to yourself with your mind
Oh
in
yeah.
terms of negative self-talk.
Yeah, reframing is huge, right? I'm 45 and I have friends who dread their birthdays. I mean, dread it. They go through almost like depression when their birthdays roll around because they are so upset about getting older and what that looks like, and fearful about what's ahead instead of being excited, right? Like, what's in store for me next, right? So it's like
Right.
reframing. And I've met so many beautiful, like objectively beautiful people who cannot see when they look in the mirror that they're attractive and they're
It's so
beautiful
true.
because it's here, right? So
Yeah.
we have to work on that too because it makes me sad when someone can't see, like, you are, like, not just subjectively, like
Yes.
objectively attractive, but they don't see
Exactly.
it. And
Yeah.
that's where, like, that mindset comes in, and reframing, and it makes a huge difference because
Yeah.
I say aging's going to happen to us, right? It's a gift. If we're not
It
aging,
is a
we're
gift.
dead, right?
It is a gift. It really, really
Yeah,
is. And we talked earlier about influencing those things you can. Man, I'll tell you what, we have a lot of influence over our health by how we manage our stress, by
right.
how we spend our time, if we're always, and the lifestyle is so important. And that's really kind of what I'm all about.
Oh
Let's
yeah.
talk just a little bit about your approach to minimal skincare, which I really, really like.
Yeah, I think universally dermatologists, like, we are all on the same page with this. That skincare really can be simple, and it really should be simple. And when I tell people my skincare regimen, they're usually like, "Wait a minute, like, you're not giving me the full picture." But what I just don't really enjoy spending a lot of money or time on my skincare.
Mm,
For me, I'd rather go get a massage, go do yoga, read. Like, there are other things I'd rather do. Now, I get some people really enjoy the experience of skincare, and
sure.
so you're gonna modify it based on what you like. But the basics truly are a gentle cleanser, sunscreen, and moisturizer. And it truly can be just that. That is what my mother does. I cannot
That's
convince her
awesome.
to do anything beyond that. And she's 70 and beautiful.
Yeah.
So if you are a true minimalist, that, you can just keep it right there. Now, I'm a little extra. I like to throw in a few extras. I am a big fan of a tretinoin or vitamin A retinoid product that probably your listeners have heard of. And so
Yes.
I have been using that for, decades. I stopped when I had
Right.
children and then back on it. And to me, that beyond sunscreen is such a powerful cream to boost collagen. I know so many people are doing the collagen supplements and the face mask and all these things, and that may work, but I'll tell you what 100% works is using a retinoid. And we have a lot of research on that and data. The biggest thing is it's irritating. It can dry your
Oh,
skin, make it
mhm,
flaky. So it's not
mhm,
always the most fun to use. It does take a little bit of getting used to. I say it's like going to the gym and starting to work out. If you haven't been to the gym in a while, it's gonna be painful. You're not gonna be
right.
able to do very much. And the next day you're gonna be really sore. So just like a muscle, you have to slowly use it and work up. And but I to me, that's like your biggest bang for your buck anti-aging product if you want to use in the evening. And then I also think a vitamin C or antioxidant serum is important, especially midlife and beyond. It can help with
Mhm,
discoloration on the skin, but it also pairs really well with your sunscreen. It's going to be working on the skin to fight off the free oxygen radicals from pollution in the air, secondhand smoke, UV damage, etc. So it's going to be powerful doing that. And really, so that's my skincare routine. I've recently started using an estriol cream and replaced my moisturizer with that. But that's really, I would say, it. Even if you're a maximalist, I'm
right.
trying to think like what else you need. Like I'm not a big fan of separate moisturizer for your body versus your face or an eye cream just for your eyes. Like to me,
Yeah.
it's unnecessary if you truly, again, want to really make it a whole experience. I suppose you could do that, but there's really no need to have separate products for different parts of your body.
So, are there a difference in the retinoid products that you can buy at the drugstore versus ones you can get at a dermatologist's office?
Yes, definitely. So retinol, I just think of that O as over the counter.
Ah,
And then I know retinoid has an O in it too, but that one's a prescription. So retinol with a NOL is over the counter, not as strong, not as like regulated, I guess you could say. It's
right.
hard to
Right.
know like what percentage you're really getting.
Mhm.
It's not the active form, so it has to be, has to go through this process to turn into retinoic acid. It's a good starter for people if you are concerned about trying one or concerned about irritation. But if you really want to see the results, using something like a prescription strength is going to give you the best results. If you want to try something over the counter that's a little stronger than a retinol, you could try something like adapalene, which is a brand name Differin. And sometimes I'll recommend that for my patients who want to do a little bit stronger than a retinol, but aren't quite ready for a prescription. But really, for me, the key is not to use a lot of it. Mix it with a moisturizer, and don't do it every day. And I think if you do those techniques, then
Mhm.
most people can get used to it.
I was just gonna ask you, it's probably really important to get instructions on how to the dosage, and because I
Right.
know I've been told to mix it with a moisturizer as well, and, um, I think that's really good advice. So talk to your dermatologist about that. Don't just go get some and slather it on yourself.
Right. I think a lot of people put it on like a moisturizer and it's just way, way too much. I mean, teeny
Exactly.
tiny amount, blend it with a moisturizer, or I blend it with my estriol cream. And I find that I can tolerate it. I don't use it every night. My skin used to be able to handle that and I can't. So that's okay. I just do it, as many nights a week I can.
So you said you've been using that for decades, and I'm guessing based on what you said earlier that when a woman is in their younger 20s is when they start losing some of the good stuff from their skin. Is that when you would recommend starting that?
That might be a little young. Honestly, I used it for acne.
Uh-huh.
So we use this medication for acne, and I did have acne. So I used it probably in my teen years, and then probably didn't use it until my late 20s, honestly, when I was going through derm residency.
Sure.
So I don't necessarily think 20-year-olds need to be using this unless they're struggling with acne. Your collagen is still pretty good. I would say for 20-year-olds, start just like maximizing sun protection, your diet,
Right.
sleep, start establishing those lifestyle habits rather
For
than
sure.
the tretinoin. I would say by your late 20s, early 30s, if that would be a good time to start. The issue is a lot of women are having kids at that time,
Yes.
and we don't really have data to say if it's safe or not. So, as
Right.
dermatologists, we recommend you just hold off when you're pregnant,
Right.
and then you can resume it later.
Even if you're nursing, just out of curiosity.
You are probably okay to use it when you're nursing, as you know, as long as your baby is not like licking it. So,
Yeah. Okay. So my daughter, who I have twin daughters, and they both have perfect skin, and my one of them said to me the other day, "I really should start a skincare routine." I'm like, "Yeah, you really probably should." Um, but apparently they got good genes from their dad's side of the family or something. But I want her to listen to this because I like the simplicity. Now, here's a question. Because of all the YouTube and TikTok and, kids see it on Instagram and whatever, my 8-year-old granddaughter is very into her skincare.
yeah.
She has to do her skincare. That's what she wanted for Christmas last year, skincare products. And I'm thinking, well, for the love of God, you know, how about some soap and water? But I did
Yeah.
get her, some little moisturizer and some little, what do you think about that? What are your thoughts about that?
Yeah. Well,
What
I
should
think I'm
children be using?
interested. How old's your daughter? Your twin daughters?
They're 38.
Okay. Well, it's so interesting. So they don't have a skincare regimen, and yet the 8-year-old
I
does.
know.
Well, so I mean, just to make you feel better, my kids do this too, right? I mean, my daughter loves to wear makeup. She was in pre-K during COVID, and it was her favorite thing to go put on like a full face of makeup for her
Oh,
Zoom
yeah.
calls, right? So
Oh, yeah.
this is a little bit innate in people. They just, I'm not a big makeup person, but they see it looks fun and all that. So I would say it's okay to have fun with skincare, right? And again, I think a lot of it is modeling the behavior you want them to have. My kids
Right.
don't see me staring in front of the mirror, saying how ugly I am. Oh, look
Oh,
how gross
gosh.
my face looks and wrinkles and all that. I don't talk like that. Even if I have those thoughts in my head, I don't verbalize them. They see me wear sunscreen. They see me put on sunscreen every day. They see me wear a hat when I go outside. I
Yeah.
talk about, moisturizer or, putting some Aquaphor on their lips if they're chapped and dry, and
Mhm.
talking about what cleanser they should use in the shower and how to appropriately wash their bodies, right? But that being said, they do enjoy the fun of, they call it their beauty routine, and they
I
want the
love it.
headband.
Oh,
So I
yeah.
would say I'm not trying to ruin every child's fun or every person's fun. If you really enjoy that, but I would just try to teach them healthy skin habits. Um, my children, I let them pick out their own sunscreen. So they like Elta
Well, that's
MD. They
great.
think that is, fancy. Ariana Grande, I guess, endorsed it once, and so now they're hooked. And
Yep.
so I let them pick out maybe a sunscreen that they like, or let them pick out maybe a moisturizer or cleanser. But I am by no means giving them peels and giving
Oh
them,
my gosh.
actives and things like that. Now, if they want to take a bubble bath with some bath salts or whatever here and there.
Sure.
So I think it's okay to have fun.
Mhm.
But I just don't want them thinking they have to spend an hour getting ready in the morning to look
Right.
presentable to go to school or whatever,
Oh my
that they have to
gosh.
load their face up with makeup to
Absolutely.
be considered, beautiful. Um,
Yeah.
so it's a balancing act, and certainly these kids are being marketed to heavily.
They
Um,
sure are. Even, like, some of the Sephora and whatever, they
yeah,
have those children's I'm like, "Come on."
yeah.
Okay. Yeah. So we keep it minimal, but they love a good spa and makeup day. So
Oh
that we
yeah.
have great fun with that.
Well, I actually I did a funny video where my son he loves to do like beauty routines to me. And so I was like, you know what?
I love
Like,
that.
okay, it's better he's doing it to me than, so he washed my hair, he styled my hair,
I
and
love
he
that.
did my makeup. So there are ways to let them do it without without it necessarily being on their skin too.
That is such a good mom. What a great, great thing. I
I
love
looked
that.
amazing. I really looked fabulous.
That is such a fun thing to do. So I think that, for your specialty, my specialty. It's about embracing who you are,
Yeah.
learning to appreciate who you are, being grateful for growing old, accepting the things you cannot change, doing what you can if it makes you feel good. I have a question because one of your podcasts, it was so cute. You were like, I've never had a facial.
Yeah. I still
Have
haven't.
you had a facial since then?
I haven't. I haven't. I know people are shocked. It
I
does
love
it
it.
sounds lovely. Here's my main issue with it. I see when I see people getting facials, they're getting a lot of stuff put on their skin, and to me, I don't like a lot of stuff being put on my skin, and, I
Right.
also don't like people touching my skin, so
Oh, well, there's
that
the thing.
that's my give me a deep tissue massage any day. Like,
Yeah,
that's how I wanna spend 60 minutes.
for
I mean,
sure.
I'm sure it's relaxing and feels amazing. I guess I just never had any skin concern I thought it would really address, which is
Yeah.
why I haven't done it. So, I call it the hot girl hamster wheel. There's so many things you can do, but you don't have to do all of them.
I
So
love that.
pick what you want. Like I also just gave up pedicures and manicures. I was like,
I did too.
it's not, I don't enjoy it. I feel like it's a waste of my time. It's expensive.
Yes.
And I'm like, why am I doing this? So this summer I was like, I am just going natural.
I
And
did the same thing about 8 months ago.
yeah.
I'm like, "You know
Yeah.
what? I'll paint my own nails if they whatever." I
Yeah.
agree. Yeah.
Yep.
So,
So no facial for me still.
that is so funny. I have had a couple and I loved them,
Yeah.
not because I thought they were gonna, like, magically get rid of the cracks in my face, but they did. I thought it felt great,
Oh
but
yeah.
not what
That's
I
what
would
I hear. That's what I
and not
hear.
what I would spend my time or money on, really. I'd much
Yeah.
rather have the massage with like you.
Yes.
Okay, so how can people get in touch with you? I know you're in Atlanta, but you're also online a lot and you
Yeah.
give amazing information. The podcast is the Skin Real, REAL. Tell us more information about how to get in contact with you.
Yeah, absolutely. So definitely check out the podcast. I also have an app on, you can get it on Apple and or
Yes.
iPhones and Android. So SkinReal as well. And if you're wondering, how do I create healthy skin habits for myself? I've got a little guide you can get at theskinreal.com/habits. And if you want to be a patient, my practice is Baucom and Mina Derm Surgery and would love to see you.
I will put all that information in the show notes and I am going to come and see you.
I would love that.
I love that you're in Atlanta. I
I know,
really
so fun.
appreciate that you took the time to let people know you can get on that hot girl hamster wheel all you want, but at some point we have to embrace who we are, figure out where we want to put our time, stress, money, energy,
Right.
and it's no shame. Do what you want to do as long as you're not trying to unhate yourself through your physical appearance. So
Exactly.
so do the head work too. You are delightful and real and fun, and you got great kids, I can tell, and you're a good mom. All right,
Oh,
thank you
thank
so much
you.
for being with us, and I will let you know when this is gonna, drop, and would love to have you on another time.
Yeah, amazing. So fun. Share all that with me, and I'll definitely cross promote with my audience.
Perfect. Thanks so much, Dr.
Okay,
Mina. So good.
bye.
Bye-bye.